zooming out a little bit more, so that's like, say you have the knee joint specifically, are there movements you can drive through like your shoulder, thorax, things like that to help with that motion as well? And like, what's kind of the mechanisms driving that?
So, hang on, get some smoothie.
Gives you energy.
Yep. So the tibia will follow a lot of what the talus will do, and vice versa, right? So that's why I'll cue a lot of different foot positions for that individual. So say I'm trying to regain tibial internal rotation, well, then I'm just going to cue a little bit more foot pronation. That'll help with regaining a lot of that tibial internal rotation. I'll even say like, hey, if you push, the ball of your foot and the inside of your heel into the wall, do you feel how your shin will actually turn in when you do that? And they'll be like, yes. I'm like, okay, great. Keep doing that, right? That'll be buy-in for them as well. The other thing too that we're trying to achieve, and this kind of goes back to the gait discussion and kind of delaying that foot on the ground. So that'll be a little bit more internal rotation at the hip as they're walking. So even with like that cross extensor exercise where they're just doing a marching activity, as they bring that opposite leg up towards their chest, that'll actually help to reshape the pelvis into a position that allows for more internal rotation to be demonstrated at the femur and at the tibia itself to enable a little bit more of that extension to occur. So that'll be another way in which I'm trying to drive a lot of those mechanisms too.
Can you explain how flexing one hip, extending the other would drive internal rotation on the extending side?
So and this is a lot of Bill's stuff. So he'll talk about like everything is just transverse plane, right? So everything's all rotation. So as well as, this is actually a cool little example. So it's all shape change and it's all rotation, right? So if you take your leg up into flexion, the muscles will reorient to create a shape of the actual pelvis that would be nutation of the sacrum and a posterior orientation of the ilium. It widens the IPA, and what happens is the acetabulum will actually antevert to allow for more internal rotation to be demonstrated. So in order to get full extension of a hip, the same shape needs to be present as well. So in something like a marching activity, one side is demonstrating internal rotation, and the other side is also demonstrating internal rotation because of the shape of the pelvis, insofar as how it's being reshaped as you're doing that motion.
Explain why driving some of these rotations above and below a joint you're working at may restore motion in what we typically would consider like a more front to back sagittal plane type movement.
So this is like the knee podcast, I guess, but I think knees are a good example of it, because
good stuff.
People liken, like you said, the knee to a door hinge or a hinge joint, right? But there's actually a considerable amount of rotation that needs to occur in order to actually have the joint glide effectively through all of its motion. So a big part of what I tell people and what I evaluate with a knee patient, even if it is a knee replacement patient, is that I need to try and restore some of that rotation back to that joint. And a lot of the times, even if what I'll do is I'll just take my hand as like an example for them. I'll just take my hand and I'll turn their joint into a position that they're not biased towards. So let's say you got someone who has a crazy amount of tibial ER. Best way to evaluate that would be find tibial tuberosity and the pole of their patella and see okay, how malaligned is it, pretty much. And I'll pretty much just turn it in, and then I'll try and flex their knee as much as they're comfortable. And a lot of times they'll be like, oh, it goes way farther. That feels way better. I don't get any of that pinching. It doesn't feel like it's getting bunched up, things like that. And that's one, it's great buy-in as far as okay, this guy actually knows what he's talking about. And two, it's great buy-in for, you got to be a little bit more meticulous about how you're doing something as simple as a quad set, in order to effectively regain some of the motion that we're trying to get, right? And so that little example is like, oh, okay, we can actually get a decent amount of my motion back fairly quickly if I'm just diligent enough with how I'm executing this kind of activity.